One of the many important things in treating the lumbar spine is being able to differentiate between a lumbar problem and a sacroiliac joint condition. Two of the many common positional faults at the sacroiliac joint are an anterior or posterior innominate spine. It's important that you as the examiner go through a thorough evaluation to differentiate sacroiliac and lumbar conditions. The Mulligan concept has two such techniques to try and treat a posterior or anterior iliac spine. Brian.
The ilium is quite prominent on the sacrum, and you locate the thinner eminence on the ilium. The patient is the first technique is one where we've elicited pain when we do a spring test on the sacroiliac joint there. The patient says that's painful. There are many other signs which lead you to this, but you locate on that ilium, and you're now going to apply a force that causes some distraction or attempted distraction at the sacroiliac joint, and it's repositioning the ilium ventrally as if it's come too far back. So that's, they call that a posterior innominate, so we've hooked on there, and we're applying a force that slightly distracts and places the ilium forward. While we sustain that, we get the patient to do an extension and lying. Now, when you do extensions, the ilium, the sacrum initially goes forward. But if you keep coming up and up and up, it starts to come back. So if you've got a positional fault there, by doing these extensions in lying, you're correcting that positional fault. And the proof of the pudding's in the eating. If you're repositioning, they're doing the exercise, I can almost guarantee after 3 sets of 10, they have no pain in that area when you do a spring test. Okay. It eliminates it completely. And I don't know the magic or the reason for 3 sets of 10. After 10, oh, that's a bit better. After 20, oh, yes. After 30, they say, hey, that's better. Here we have a patient where we've tried this procedure. We've done a little spring test on the sacroiliac joint, and they say, gosh, that's very painful. We want to get rid of that. This is what we can do. You agree? Locate our thin eminence on the ilium. And when you locate, I can feel it right there. I'm on it.
And you're making a contact, Brian, on the posterior superior iliac spine?
Yep.
On the medial border?
Yes. Okay. Just coming over, just tucking it in there. Okay. Right. Now, what I do is just sustain that, and I will get the patient to do an extension and lying. And can you just push up for me, please, Ed? And he comes as far as he can. I might even encourage him while I maintain that translation and down. And he will do 10 of those. After 10, I will retest, and he might say, oh, yes, that's perhaps a bit better. I will do another 10 and retest. He might say, hey, that's getting better. And you'll normally find if this treatment is indicated, no pain has been produced during the whole session. And at the end of 30 of these, I've got no pain.
Now, Brian, the sacroiliac joint doesn't have a tremendous amount of mobility.
No.
The movement is very subtle.
Yep.
Just talk for a second how you might vary your line of drive to clear. Now, this is a correction for a posterior innominate.
Yes.
So is this a lateral glide? Is it an anterior glide? Or are you trying to find the correct plane that's parallel to the joint surface?
That's right. Quite often when you apply this technique, if you're going in the wrong direction, when they come up, they say that's uncomfortable. And I'm just making subtle changes so there's no discomfort at all.
So even with sacroiliac joint conditions, you expect immediate changes in their range of motion and in their pain levels?
Yes. What they come in with, they go without.
Okay.
Go out with, how do you say that? What they came in with, they leave behind. Leave it behind. But there we are. That's okay. And, of course, it could be you need to go the other way. So you locate on the anterior superior iliac spine, fixate the sacrum, pull that up, and Mr. Ed does his extensions and lying.
And this hand is providing some sacral counterpressure?
Yes, it is. Yeah.
Okay.
But normally, if you've got an anterior innominate, we do it in weight bearing, and we do something slightly different.
Well, let's take a look in weight bearing. Ed, go ahead and sit up, Ed.
Now, we're going to put you on the floor. Thank you. Many patients with sacroiliac problems come in and say, I've got pain now while I'm standing. And when they say that, I ask, do you have it when you're walking? And they will always confirm they do. So I reposition the ilium on the sacrum to see if it turns the pain off. And it's quite neat when they've got pain withstanding, because I get a bit excited because I expect it to turn it off. How do I do this? I locate on the anterior superior iliac spine, and I locate on the border of the sacrum where it articulates, or as close to where it articulates with the ilium. There's my fixation, and I pull that back. Can you feel me pulling that back? Mm-hmm. Yep. The moment I pull that back, if this is indicated, they say, that feels better, and I'm not happy with the word better. I want no pain, so I just, change the directions. That's now pain-free. I now carry out a function, and the function that was disturbing them was walking. So that while I'm sustaining this repositioning, I get the patient to walk around. And every step should be pain-free. And what's happening in clinics now, people that know this technique, they put them on a treadmill. And they reposition the ilium on the sacrum, and the patient's walking on the treadmill while you stand behind them and holding things together. Just a couple of points. The moment I pull that back, he tends to rotate. When he starts to walk, I tell him to fight against me and go straight forward. Don't let me make him rotate. And last year in Boston, a girl came up to me before we started the 2-day program. She said, Brian, I've got a terrible sacroiliac joint. I've got to go home. Thank goodness my husband's here. He will take the course and he'll tell me what you're going to teach. And I said, is it painful now? And she said, yes. So I did this procedure. She had no pain. I walked around the ballroom, and there were, I don't know, 80, 90 people. And after 2 circuits of the ballroom, she had no pain. She stayed on the course all day. Next day, she came up to me and said, Brian, I've had no pain since you did this yesterday. And she had an acute sacroiliac. And her pain was walking, standing, repositioned. And of course, we had witnesses.
So again, as in the lumbar spine, if they have more pain sitting than standing, you would start your care in sitting.
Of course you do.
And same thing with the sacroiliac joint. If they have more pain in a weight-bearing posture,
you start straight away.
You will start your care in a weight-bearing posture.
Yep. And other little tips you might find useful. Quite often you get a problem because one leg's a bit longer than the other, and you can sort of give them a little heel raise till they're better. And in the case of the anterior nominate, when they're sitting, I tell them to put under their behind on the left side a little folded towel, and it just takes the stress off that joint, because a longer leg makes us go in the correct direction. For some reason, it's gone the other way. So I'm assuming you could have a longer leg on the other side. But that's just a tip. Just get them to sit on a little pad under the buttock on the opposite side when they've got weight-bearing pain on the side. And if they feel comfortable, they do it. If they don't, forget it.
Very good.
Yeah. We've shown you the common technique that we would apply when a patient has symptoms standing and walking. On rare occasions, you've got to go the other way. You've got to wrap your arms around and reposition that ilium and then carry out a walking function. Would you be happy with me showing that?
Well, why don't you hold off on that technique? Brian, some of these techniques are field techniques. Some techniques you need to go in the opposite direction. That's an advanced handling skill. Certainly we're trying to give the home viewer a good sampling of the different techniques in the Mulligan concept, but you have to understand that much about this is all about your handling skills, your sense of feel, your sense of direction, something that might be best learned on a course. So,
yes, you actually feel it yourself.
Having an instructor with you and going through the techniques and making fine-tuning of your handling skills will go a long way.
And I want you to become perfect in all these techniques, front up, and sit the practitioner exam. Because from all around the world now, I'm getting requests from people, who can I go to if I move to Mexico? Mm-hmm. And, I can't tell them. But if you're a certified Mulligan practitioner, you're on the web page, and I can say, go to my web page, have a look. I'm sure there's someone near you in the States. Those numbers are growing, exponentially at the moment.
I know we're testing several times a year here in the U.S.
Yes, we're testing in the U.S. and in other parts. We've got certified practitioners in Turkey. We've got them in Poland, and of course, in other parts of Europe.